Hi, everyone. My name is Cheryl Bostelman, and I am a registered nurse. And I'm here to talk to you today about carpal tunnel syndrome. Carpal tunnel syndrome is also known as repetitive use syndrome. It is compression of the median nerve, which is here in your hands. When that nerve gets compressed, it causes numbness and tingling in your hands. So, some little facts about carpal tunnel syndrome. It happens 3 times as likely in women than it does men. And also, it usually occurs in ages 40 to 60 years of age. So, you're probably wondering why I'm talking to diabetic patients about carpal tunnel syndrome. Well, diabetic patients are at risk for carpal tunnel syndrome because of the high blood sugars that occur and also the inflammation and the diabetic neuropathy that can occur. So, what is carpal tunnel syndrome? What is it caused by? It is caused by repetitive use. And when I say that, I mean like you using your computer, you're texting, and also, if you use tools in your everyday job that cause vibration of some sort, that vibration can cause damage to that median nerve. So, with that, you're going to get the numbness and you're going to get the tingling. So, let me show you where your median nerve is. It's a diagram of your hand. That yellow is your median nerve right there. And when it gets trapped under those ligaments and from that repetitive use, that's what's causing that pain and that tingling and that numbness in your hands. Most patients do get the numbness and tingling in the morning, and it's after they've woken up, and it's because they like to sleep on their hands. And I am definitely one of those people. So, how is carpal tunnel diagnosed? Well, there are physical tests that can be done. The first physical test is called the Tennell's test. The clinician, nurse practitioner, will take your hand and use her fingers or his fingers, and they'll tap onto that median nerve. And if you, the patient, experience numbness or the tingling or even some pain, that is indicative of carpal tunnel syndrome. Another physical test that can be done is called the Phelan's test. The Phelan's test is where you place your hands here in the flexion position and you press up against your hands for 60 seconds. If you have pain, numbness, and tingling for that 60 seconds, that is also indicative of carpal tunnel syndrome. So, how do we treat carpal tunnel syndrome? Carpal tunnel syndrome can be treated conservatively and also with surgical intervention. So let's go over the conservative ways first. So a conservative way would be oral medications, which are usually corticosteroids. Also, you can have steroid injections into your hands. Um, Other ways to help with the carpal tunnel, you can use splints, or you can use a compression glove. And you can get these at, Target, at your local pharmacy, or, at Walmart, those places. So with the splint, they usually have them, for right or left. And what it has a metal bar right here, in here, and also here. And that helps keep your hand in a neutral position while you're doing your day-to-day jobs. There we go. So, see how it is? It's keeping your hand in that neutral position. And then with the glove, I like using the compression gloves at night because it's easier to sleep with than the splint. And what it does is when your nerve is firing constantly, giving you those, that nerve, that tingling and the numbness feeling, this glove can kind of help trap it a little bit. And that way you get some relief. And again, I like to use it at night when I sleep. Also, for work, you can get yourself a mouse pad, a padded mouse pad, and that also keeps your hand and that wrist in the neutral position while you're using that mouse. And they also have, the longer ones that go the length of your keyboard. Also, you can use a keyboard that's called a soft keyboard. So you're not pounding on the keyboard. And that also, of course, when you're pounding like that, you're, injuring yourself. You're injuring that median nerve. So with surgical interventions, usually the doctor or the nurse practitioner will tell you um, that you possibly need surgery when the conservative measures just do not work for you. So when they suggest that, usually what happens, you'll have the surgery, you'll be in a cast for 6 to 8 weeks, and then afterwards, you'll have occupational therapy. The occupational therapy is for you to get your strength back in your hands. I hope this talk helped you today about carpal tunnel syndrome. Please, if you have any questions, please ask your nurse practitioner or your primary care physician. Thank you.